The science behind depression. What is depression? Depression is a disease that impacts over 264 million people of all ages worldwide. A common misconception about depression or depressive mood disorder is that it simply means being sad. While sadness, fatigue, and a general sense of lethargy can all be symptoms of depression, sadness is an emotion. In contrast, depression is a long-term mental state that can range from mild to severe depending on the patient. Other symptoms of depression can include a lack of interest in activities that were once enjoyable, decreased motivation, getting too much or too little sleep, gaining or losing weight, slowing of movement and thought, hopelessness, an inability to concentrate, feeling worthless, and suicidal thoughts or actions. These symptoms result in a significant difficulty for patients with depression to complete a daily routine. But what causes depression? Depression is the result of a variety of biological, genetic, psychological, social, and environmental factors. Often, the cause behind depression is simply chalked up to chemical imbalances in the brain. Neurotransmitters, the chemical messengers in the brain that neurons release and receive in order to communicate with each other, are an integral part of attention, mood, cognition, learning, motivation, and sleep. So an imbalance may be one of many causes behind depression. When patients with depression were given medications increasing the neurotransmitters norepinephrine, dopamine, and in particular serotonin, the neurotransmitter associated with regulating happiness, serenity, and hope, patients experienced an improvement in their symptoms. This theory of low levels of dopamine, serotonin, and norepinephrine resulting in depression is known as the monoamine deficiency theory. However, depression and the factors resulting in it vary by patient. It's more complicated than just a neurochemical imbalance. Mental health issues can also be influenced by societal climate and global events. Extreme stressors are already a trigger and risk factor for mental health disorders like depression. Psychological trauma resulting from the death of a loved one, or abuse, unemployment, racism, and displacement are only a few examples. In the midst of the COVID-19 pandemic, the presence of extreme stressors and the impact of isolation during quarantine or stay-at-home orders cannot be overlooked. Increased stress and paranoia can exacerbate a pre-existing condition of depression or result in symptoms for an individual at risk. If you are a loved one or exhibiting signs of depression, talk to your doctor about what treatment options are available. In addition to a prescribed medication, opening up to loved ones, talking to a support network, exercising, meditation, and self-care may help with managing depression. Ultimately, it's important to remember that depression does not have one singular cause. We are still seeking to understand this disease that impacts so many. You can help by eliminating the stigma surrounding depression. The more we understand about this disease, the better we will be able to treat and understand patients who have depression.